Good morning, everybody, or afternoon, depending on where you might be. Welcome, and thank you for taking the time to be with us today. We appreciate you making time in your schedules to join us. To provide a basis for much of our discussion today, we wanted to first go through some highlights as they pertain to the field of neuropsychology and provide some higher-level background as to the development of the field as an independent discipline. At its core, neuropsychology relies upon an interdisciplinary collaboration to evaluate, describe, and diagnose the interrelatedness between the brain and cognitive and behavioral manifestations. The two main fields that really draw into neuropsychology in regards to its practice are neurology and psychology. However, there are other fields in areas of science that also contribute, but these are the two main areas. The idea about the brain-behavior connection dates way back and can be observed in early works of René Descartes or even Aristotle. However, the more tangible evidence that would lay the groundwork for the discipline began to emerge with the works of Paul Broca in the mid-19th century. Paul Broca, who was a French physician, was the first one to demonstrate the idea of functional localization and brain anatomy. Broca revealed through his experiments that patients with non-fluent aphasia had corresponding brain lesions in the anterior left hemisphere of the brain. And this was really the first time that someone related language with the specific area in the brain. And then shortly afterwards, Karl Wernicke, who was a German physician at the time, continued to build on Broca's line of research and identified other areas of brain localization for language deficits as well. His discovery of receptive aphasia, which correlated to lesions found in the left posterior region of the temporal lobe, continued to build on this idea of language and its relation to specific brain structures. Also during this time, we had observed an American physician named Robert Bartholow who conducted experiments. He conducted an experiment on a woman who actually had her brain exposed due to a cancerous ulcer. And Bartholow applied electrical current stimulation directly to this woman's brain and observed various physical movements as well as a variety of emotional responses as well. The woman was observed to be crying when he touched certain areas of the dura. I would note that during this time, his experiments were viewed as unethical and criticized by the American Medical Association, although Bartholow did continue to practice and continue on in his research. From this point onward, there were many more advances that paved the way to further refine the understanding of the cause and effect relationship between the brain and behavior and personality. The understanding of the functional organization of the brain continues to this day, and we continue to look to refine our understanding of that. Advances in technology have greatly advanced in the development of the field. And two of the most prominent advances, I would argue, are in the areas of neuropsychological testing and neuroimaging. Okay. Two of the main types of imaging available as it relates to neuropsychology really are structural imaging and functional imaging. And it's really functional imaging that is most often utilized to assist in neuropsychological assessment. This functional imaging allows for a finer scale in regards to metabolic functioning. Oftentimes, research will even involve the subject to perform various neuropsychological tests concurrently with imaging scans, such as a functional MRI. There's been occasions where they will put the subject or the patient into the MRI scanning machine, and the patient will be able to see above them, either through a mirror or some other type of device, a cognitive or neuropsychological test set before them, and they will respond to the stimulus on the screens, either verbally or by pushing a button with their finger, and then different areas of their brain activity will light up on the scan. So it's all kinds of uses. All right. Apart from neuroimaging procedures, neuropsychological testing is a way for neuropsychology practitioners to measure brain functioning as it relates to structure and processing. This type of testing is often done or should be done in a controlled clinical setting and allows for the diagnosis of deficits. It has implications for both treatment and research as well. Of note is Alexander Loria. He was a Russian neuropsychologist who played a major role in defining neuropsychology as it's practiced and recognized today. In 1962, Loria published his textbook, Higher Cortical Functions in Man, and it was this textbook and his research that really set the stage for the modern concept of neuropsychology as an independent discipline.